2020, malaria caused 627,000 deaths globally, where 61% of them were children under 5. Many of the victims live in Africa or Southeast Asia, in tropical climates where mosquitoes are abundant and have easy access to houses built of locally sourced materials like bricks, thatch, mud, which are not sealed off like your typical home in the UK. The public health authorities in countries like India fight a constant battle to fumigate homes with insecticides to tackle not only malaria-carrying mosquitoes, but other diseases bearing vectors such as sandflies, which spread a disease called visceral leishmaniasis or VL. VL is fatal if left untreated in over 95% of cases, and it's associated with malnutrition and poverty. Despite deploying armies of sprayers, the results are mixed. Spraying too much can be harmful to occupants, or spraying too little has no effect. Current monitoring methods are time-consuming and expensive. Sensor technology developed here in Liverpool is now being trialed to ensure quality of spraying. The technology was initially developed here in Liverpool at exemplar houses, where the sensor primarily was monitoring the excess of moisture in building fabrics. Working with Liverpool School of Tropical Medicine in a project funded by Bill and Melinda Gates Foundation, myself and fellow multidisciplinary colleagues like world-leading expert entomologists from LSTM, microwave engineers and machine learning experts from LGMU proposed a handheld sensor to ensure the correct dosage of insecticides on a wall. It is the adaptation of sensor that we developed to measure the source of moisture between building fabrics using advanced microwave or electromagnetic spectroscopy, which now has made a significant step in protecting homes from disease carriers. Due to the high burden of VL in India, we launched the project there and developed a tool to assess the insecticide alpha-cypermethrin, which is sprayed on cattle sheds and houses. Currently, indoor residual spraying team comes to villages and sprays houses twice a year by providing a layer of insecticide onto the building fabric. Without an existing technology to assess the quality of the spraying, the sprayers do not know if the quantity of the insecticide is at the correct dose, and therefore if it's effective in killing the sandflies and mosquitoes. The sensor consists of 3 sections. The first one is the electromagnetic generation and detection. The second one is data analysis of the signal. And the third one is user-friendly display, which demonstrates the dosage of the insecticide. The sensor is powered by a standard batteries seated in the handle of the sensor. The project is now part of the activities led by the Infection Innovation Consortium ICON, a UKRI government-funded program which brings novel products to market to address global health concerns, and we linked up with a local Merseyside manufacturer, 4D Products Limited, to create mass-producible enclosure. During tests in India, the sensors contributed to 90% drop in VL transmission by 2019, and for the first time ever recorded no one in Asia died of VL. The success of the project has meant we have since secured additional funding from the Gates Foundation to develop this technology further, to allow for measurements of multiple concentrations and insecticides commonly found in Africa, which is a considerable challenge that we are eager to pursue. We have currently sent multiple sensors into India, and in the upcoming months we will validate if the developed technology can monitor effectively the performance of sprayers in developing countries. In a little over 4 years, we have turned a research concept into an innovative technology which has already contributed to saving lives and tackling deadly diseases around the world.